It's Patrick Hutzel from Intensive Care at Home, where we provide tailor-made solutions for long-term ventilated adults and children with tracheostomies by improving their quality of life, and where we also provide tailor-made solutions to hospitals and intensive care units to save money and resources whilst providing quality care. In last week's blog, I shared Intensive Care at Home, better home care solutions for long-term ventilated adults and children with tracheostomies. You can check out last week's blog by clicking on the link below this video. In this week's blog, I want to share how to transition a ventilated adult or child from intensive care to a home care environment. Many inquiries that we get, regardless if they are hospitals, intensive care units, or if they are inquiries from patients and their families, they simply want to know how it works when making a successful transition from intensive care to a home care environment for ventilated adults and children with tracheostomies. Therefore, I want to pull the curtain today and I want to bring some transparency in the process of how a successful transition happens from intensive care to home. Up until recently, most outdated and old-fashioned paradigms in intensive care in Australia, the UK, as well as in the US and Canada, suggested that patients either leave intensive care to go to a hospital ward or they'd die. What a bleak outlook, as well as limited and narrow-minded thinking. Now, intensive care units in Europe, mainly in Germany, Austria, Switzerland, and France, have been discharging ventilated patients from their ICUs to an intensive home care environment for the last 20 years. And why? Because they give intensive care patients and their families choice, because they have long ago realized that long-term ventilated adults and children with tracheostomies don't belong to intensive care, and the only way to improve their quality of life is in an intensive home care environment. The only way to save 50% of the cost for these patients is also to discharge them home. What can't be measured in monetary terms is that we improve the quality of life for our patients and their families. By discharging some intensive care patients home also helps other critically ill patients to get access to precious, scarce, in-demand, and expensive intensive care beds. It's a win-win. And now let's quickly look at how to make a successful transition for long-term ventilated intensive care patients to home possible. The short statement is, it's not easy, but it's simple. The good news is that we know how to do it, and we have developed intellectual property around it with our third-party accreditation for intensive care at home services. I have been involved personally in many successful transitions from intensive care to a home care environment for ventilated adults and children with tracheostomies in Germany and in Australia. Therefore, for all the naysayers, it's possible. It just needs the right setup, the right equipment, and most importantly, it needs the right mindset. For those intensive care units, departments of health, and private health funds who want to stay in the dark ages, who want to keep paying $5,000 per bed day instead of reducing the cost by 50% and don't want to give their patients and their families choice to improve their quality of life at home, yes, intensive care at home is possible, full stop. How? Well, it's a matter of creating the right environment by setting up a mini ICU at home with the right equipment and the right staff, who most importantly have the right mindset. We work with intensive care nursing staff and we work with medical specialists such as respiratory physicians, intensivists, pediatricians, and GPs. For more detailed information in how to make a successful transition possible, you can also check out our section, Discharge Management. There's a link on the right side of the website. If you have any questions how to make a transition from intensive care to home possible, just leave your questions on the blog below this video. If you want to find out how we can help you to get your loved one out of intensive care or long-term acute care, or also out of a nursing home, or if you find that you have insufficient support for your loved one at home on a ventilator, or if you have any questions, please send me an email or call on one of the numbers on the top of the website. We are also an NDIS, TAC and DVA approved community service provider in Australia. We're also part of the Royal Melbourne Health Accelerator program at the moment, and I'll put some links to that program below this video. Thank you for tuning into this week's blog. This is Patrick Hutzel from Intensive Care at Home, and I'll see you again next week in another update.